Good afternoon. I am Princess and I will do the presentation in behalf of Group 1. Our group will be presenting the mental health and opioid crisis faced by academic libraries. This presentation will cover our selected library, which is an academic library, and the opioid and mental health issues that it faces. We will be looking at the other libraries that are also affected by the same issue. We will also look at library advocacies that address the opioid and mental health crisis. And lastly, our group compiled some recommendations on how academic library and other libraries can address the mental health and opioid crisis in their libraries. Academic library is usually part of a large university, and the patron that often come are faculty, school staffs, and students. Although the majority of library users in academic libraries are students. Students come to the library to study, do research, do their assignments, and sometimes just come because they need a quiet space. The issue that our library is facing is an increase in the number of students facing mental health crisis, which result in burnout, stress, and depression. These mental health crises at times may result in the suicide of the student. Studying at the university requires expectations and stresses on students, making them more vulnerable to psychological suffering. Aside from academic obligation, other causes of mental health difficulties among college students include school culture and discrimination based on race, ethnicity, gender, or sexual orientation. Financial stress caused by tuition costs is another factor that contributes to poor mental health. Opioid crisis and opioid abuse is rarer. However, it does happen and it can be used as an escape for some students that are struggling with their mental health and other factors. Academic libraries see cases of mental health crisis on a regular basis due to students continuously studying hard for upcoming exams and dealing with other factors that put stress on them. Public library also see these cases as a more consistent occurrence due to serving a larger community. The opioid crisis as well would be more commonly seen in public libraries than in academic libraries, since public library caters to people of the community in comparison to academic library that caters to faculty and students only. This means that anyone can walk into the library space and use the facilities. Aside from academic libraries, public libraries are also affected by mental health and opioid crisis. In fact, they are the most affected libraries. Here are some libraries that are impacted by the opioid crisis. In the survey conducted by Wrigley across the public library system in North Carolina, 9 out of 20 library directors reported that their library was directly impacted by the opioid crisis. This impact mostly involved the overdose of a patron in the library and increased information seeking from patrons who were affected by the crisis. In another study conducted by Wiggins, a large urban public system in northeastern United States has been shown to be a place for community members to seek support and refuge as they face their psychosocial crisis. This has led the library staff to take on both a role as both a public library and a space for social work. In the first study in North Carolina, some libraries that face an opioid crisis reported that they had their staff trained for overdose incidents. Some reported that they would collaborate with local organizations, such as the EMP department, and only 3 libraries reported that they had formal policies related to community opioid response effort. In a second study, the public library hosted programs and workshops focused on mental health and self-care. Other libraries have hired social workers on full-time and part-time basis to work with patrons in crisis. Some libraries have also partnered with agencies to have social worker travels between branches as part of community outreach. In response to the opioid and mental health crisis, libraries and library associations have made their advocacy to help address these library issues. A 2018 article from TBC discussed how libraries are often the front line in this fight. The article specifically did see the Vancouver Public Library and Toronto Public Library as communities' living room. Toronto Public Library, as of 2017, are undergoing overdose awareness training and are also permitted to nasally administer naloxone. As this problem escalates due to COVID, one could imagine a heightened role of library workers in dealing with the opioid epidemic. The Ontario Library Association created an information brief that contains contextual information that can enlighten the public on current library issues. The information brief entitled Opioid, Naloxone, and Your Library is available on the OLA website for library supporters and advocates. Library staff, library supporters, and advocates can use the information brief when speaking to government officials, community members, or the media. The brief will serve as a talking points on how public libraries across Canada are responding to the opioid crisis. In support of mental health issues, library associations like the Ontario Library and Information Association provide a PDF file about mental health and information resources and tools for library staff, library supporters, and advocates to use as the reference. Additionally, the Reference and User Server Association, which is a division of the American Library Association, has written an article that discusses the topic of mental health and the effect it has on people. The article does a good job of clearing stereotypes and informing library staff on the proper way of interacting with patrons who have mental illnesses. The American Library Association has provided mental health resources in libraries, which is available on the ALA website. With these issues, libraries are taking part in helping the community with mental health and well-being initiatives. Academic libraries can support student well-being by creating programs and engaging experts to discuss the experiences and potential problems they may face. Academic libraries can support college and university students by providing accurate mental health information and creating a safe space on campus. Academic demands are very stressful, especially during exams. Academic libraries can provide workshops and invite other experts in the field like tutors, wellness instructors, and even financial aid counselors to host workshops. Peer counseling and group study sessions hosted in study rooms can also be a great activity that the library can provide to students. Academic libraries can help a student struggling with opioid crisis. It can partner with hospitals and other non-government organizations, and they can work together to provide resources for drug and mental health crisis. Some people who battle addiction might not think about going to health departments to get help, but libraries are public places where people can feel more comfortable asking for help. Libraries should implement emergency procedures that specify precisely who will treat overdose victims. To help revive someone who was overdosed earlier, staff members should get training in administering an opioid overdose antidote. Here are our resources for this presentation and for our group report. We as a group were able to do this assignment by working together and making sure that we did our assigned part of the assignment. So let me recognize my teammates, Karim, Daniel, and Derek. And to everyone, thank you very much for listening to our presentation.